We spent an awful lot of time over the last several months talking about Obamacare. But somehow what gets lost in the sauce here is there are other programs out there, other health care initiatives that are very important out there. And principally, I'm talking about Medicare and Medicaid. And we're now getting evidence right now that some doctors are actually starting to walk away from both of these programs. Now, what does this mean really for the people that depend on these programs? Medicare is very important to the senior community, and certainly Medicaid is as well. So joining us to share her views on this subject is Grace Marie Turner. Grace is president of the Galen Institute, and he joins us by phone. Grace Marie, thank you so much for taking the time today.
David, pleasure to be with you. Thank you.
Grace, I read in the Journal this morning an important article that was out there that the number of doctors that are walking away from Medicare and also Medicaid is climbing dramatically. Walk us through your thought process here. What do you think?
Well, we've been seeing this coming since before Obamacare passed. And you're right, David. Obamacare really is an effort to create new insurance coverage, both for private coverage through the exchanges as well as Medicaid expansion. But there's a huge impact on Medicare for seniors, including $716 billion that has to come out of Medicare to pay for this expanded coverage for other Americans. Seniors have known this was going to impact their access to coverage. Part of it is cuts in payment rates to physicians, cuts in payment to Medicare Advantage programs, these coordinated care programs, particularly popular with senior citizens, but also the enormous amount of paperwork that all doctors that participate in any public health care program, Medicare, Medicaid, and now the exchanges, will have to fill out in order to comply. They are under serious legal regulations and restrictions on what they can do. Many of them are now saying they want to get out of Medicare, not only because the payment rates are falling, but also because of the threat that they see to confidentiality of patient medical records.
Well, that brings up a whole other issue, Grace Marie. Let me ask you this, because does this also translate, is Obamacare also affecting Medicaid as well? Because I'm reading right here a study in the journal Health Affairs this month that 33% of primary care physicians didn't accept new Medicaid patients. Is this all part of the same package, or is this a separate issue?
Well, Medicaid, of course, is also being expanded to cover about 20 million, up to 20 million more people. But Medicaid, which is the joint federal program, joint federal and state program that covers lower-income Americans, has already, in most states, been paying doctors so little that it's difficult for them to even pay their expenses. In some states, a doctor's visit pays $7. I mean, obviously, this is not something that they're going to be able to maintain over a long term. So they basically see Medicaid patients as charity patients, but they have to fill out volumes of paperwork for them, too.
Am I hearing that right? You said $7. I mean, that whole concept, my son the doctor, become a doctor, you'll live well.
Right.
Wow.
And of course they can't afford to take very many Medicaid patients, which is why so many Medicaid patients wind up going to hospital emergency rooms for even routine care, because it's so difficult for them to find a doctor, a doctor in private practice who can afford to take very many Medicaid patients. So yes, and I'm very worried that that's going to make it even more difficult for people on Medicaid today who have no other options for coverage and care to find a doctor who will see them. People write letters to me about this and tell me, I've got a daughter who's handicapped and she's on Medicaid. It takes me 6 weeks, her father wrote to me, to get an appointment with her urologist. Do they consider what will happen if we have millions more people competing for appointments with those few doctors and especially specialists?
Grace Marie, if it takes 6 weeks to get an appointment, obviously the next step is you turn to an emergency room. That's where you go.
What they do.
Look, if my son's sick, I'm taking him to the emergency room. I need the medical care right now. But Let's go into the heart of this, because this is obviously playing out before Congress. The president is out on the road. He's really trying to sell the message on a lot of things. He's principally talking about the economy, but Obamacare, of course, comes up, and the Affordable Care Act is it's certainly a big thing. And now we're starting to hear, within, the halls of Congress, we're hearing the words, let's try to defund, Obamacare. Do you think that the Republican Party will actually move forward and actually try to defund the program?
I think that they're going to do everything they can to protect the American people from this law. The Obama administration has already delayed or changed or the Congress has amended 18 provisions of this law, and the administration itself has acknowledged that they don't have a great deal of it up and running, so they're delaying many provisions till 2015. I think Congress has a responsibility to delay and defund and ultimately dismantle this law that is driving physicians out of practice. Back to this journal story.
But Grace Marie, is that really possible here? I mean, President Obama, people may disagree with him. He is the president of the United States. This law has been passed. Aren't we stuck with it? Is there really anything that can be done here?
The president has already signed into law repeal of 7 different provisions of this law. If they start to see, as they get toward January 1st, that they are headed for the train wreck that one of the Democratic authors of this law, Senator Max Baucus, said that he was worried about, I think they would welcome an opportunity to gain one more year in order to be able to
all right, I could picture that, Grace Marie. I could picture that they don't feel ready. All right,
they're not ready.
They've moved the employee mandate to 2015. Maybe the next step, let's move the individual mandate to 2015, or perhaps further out. But I cannot, in my wildest dreams, picture the Democratic Party and, in principle, this president walking away from Obamacare. They worked pretty hard to get us here. I can't picture that happening.
The administration has to create healthcare exchanges in 34 states. They thought they would have to create exchanges in 0 states because they thought states would do it themselves. And about half of the states are not expanding Medicaid because they see the high costs of this. My sense is they're not going to be ready with those federal exchanges to go live on October 1, and there are many Democrats in Congress who are advising the administration behind the scenes. We would rather see a delay than see a train wreck.
Okay, well, I don't want a train wreck. We're going to have to leave it right there. We're out of time. Grace Marie, thank you so much for spending your valuable time.
Thank you. Call me anytime.
That was, of course, Grace Marie Turner, president of the